we are live. It's 12:23 right now in the after or at night. So definitely a little bit late, but hey, it's okay. It's how we roll, right? That is how we roll. So yeah, usually I start my days late, but then from that I end my days late too. And yeah, I was actually just thinking that for my chronotype, like I am the kind of person who I like getting up late and then working late too. I'm not the type of person who likes to get up early and then work early. I've tried that so many times. I've literally tried this like every time, I have all the time in the world. I'm like, okay, I'll get up early, then I do, but I always like regret it. Well, I mean, I regret it in the sense that like I always end up reverting back to the night schedule anyway. So from this, I've pretty much just realized that, hey, you know what? I think nighttime is the way for me to do it. So yeah, that's cool. But other than that, today was mainly spent, I think working on the business. So I saw a couple patients. So I did that. Let's see. I think the main thing I was trying to figure out was this like email marketing thing, but that's where I spent the majority of my time doing. Got all my clips ready for next week, so that's good. So I got all my content ready, so I'm happy about that. Yeah, that was pretty much it. And I think tomorrow I'm going to be doing big recording sessions, so recording content for my my NP coaching community. So I'm going to be recording a bunch of videos on that. Going to be recording some videos on like copper supplements. Going to be going over some case studies that I have too. Sharing my experience with different cases. So that's the main plan that I have for tomorrow. But yeah, other than that, nothing too much. Am I a forensic psychiatrist? I am not a forensic psychiatrist. No, that was never an interest of mine. I did have a colleague. Actually, I've had two colleagues who pursued forensic psychiatry, and I've heard it makes a lot of money. But I was just never the type to be like court testifying. Like that was just not my thing. So yeah, nerd, accurate. Yes, is forensic psychiatry competitive? Not really. It's not really competitive at all, actually. People don't really want to do it, so it's pretty easy to get good fellowships to do it. I should be medicated. Why? Why should I be medicated? Yeah, was psychiatry your first choice? Yeah, that was my only choice. That's the only thing I would rather do. Like, I had no interest in being like a surgeon or anything. I knew I was going to be a psychiatrist. Like, that's why I went to med school. It was either that or family med. And like, I was pretty set. Pretty set. Did you go to WMU? I did. Yes. Yes. That's where I did residency. Do we know each other? That would be my question for you, Blasson Matthew. What is the most weight neutral antidepressant or even helpful for weight loss? Prozac is most weight neutral. Wellbutrin's the best though for weight loss. Hello. Thoughts on Seroquel versus Belsomra? Belsomra is a dedicated sleep med. Seroquel is more like an adjunct for sleep. Belsomra, I think, is tolerance is a little bit more you can develop. It's more expensive. Yeah, I think tolerance builds quicker too. So that's why most people go with Seroquel, just because it's a lot more easily available and it's way cheaper as well. They have a PGY2 opening. WMU does, really? Like right now they have a PGY2 opening? Huh. Why? Do we know why? I was just prescribed Lurasidone hydrochloride, and when I picked it up, it was 340. Yeah, Lurasidone's a generic now, so it shouldn't be that much. But a good tip that I've come across is like I mean, you should use GoodRx for one. And then the second tip is, uh, yeah, the second tip is, find like an independent pharmacy. Sometimes they have cheaper prices. Sometimes like the CVS and Walgreens and stuff, they'll rip you off. But definitely use GoodRx to try to get your meds cheaper. Hi, I'm enjoying your Q&As. What led you into your own psychiatry journey? Thank you. I appreciate that. Yeah, basically for what it was for me was in undergrad, high school, I wasn't very confident. I wanted to be more social. So I started doing that a lot more. And, joined a fraternity. And like, I left college a completely different person than I was entering it. And what I realized was that, hey, I took the action to change my own thoughts and my own beliefs about myself, right? Like I thought I wasn't cool, I couldn't be popular, like it said, like those kind of things. And so then I realized that, okay, if I can do that to help myself, then I can help other people change their own thoughts too. Because our thoughts are like the programming that come into our brains. So imagine like a thought come or like an event happens, right? Like let's say you lose a fight or like you get a C on a test. It comes through the brain. Now, one person can perceive it as, oh, okay, I got a C. Okay, I'll try next time and do better. They might have a positive outlook. But then the other person who has a negative outlook might say, oh, I'm worthless, I'm a failure, I'm never going to get into med school. So they just pass it through the negative filter. But the thing is that you can change the filters that you have in your mind. So that way, any data that passes through, it changes the thoughts that pass through. So and we can change the filters we have so that way we perceive things differently. So I always try to perceive things in the most positive way as possible. Fluoxetine is definitely for weight loss. I knew this was the doctor guy. That is me, yes. When should I give up on sertraline for obsessive thoughts? After like 6 to 8 weeks. You definitely want to give it a good trial, and you need to make sure it's a high dose too. Sometimes people are on too low doses. Thoughts on nightmares from quetiapine? Quetiapine is not really known to cause nightmares. If I've had high functioning autism, how do I cope with college as meds aren't working? It depends on what you're trying to treat. There's no meds for autism. Meds are more for like anxiety, depression, that type of thing. So I would focus on like trying to treat that stuff. Not gonna lie, when you showed up on my FYP, I thought you were a UFC fighter. I am definitely not a UFC fighter, but I appreciate it. Are you talking about Khabib? Yes, very well articulated. I appreciate that. Thank you. Yeah, ADHD. Usually stimulants are first line to treat ADHD. That's what you want to go with. What if the nightmares were every night and stopped when I was taking quetiapine? So if the nightmares were every night and they stopped when taking quetiapine, that can make sense. Quetiapine is very calming. I used to use it a lot for the vets that I worked with. And so when I used it when I worked at the VA, I really liked it because it helped people go to sleep and then stay asleep too. I'm trying to get my husband to stop thinking negatively all the time. Yeah, it's a practice. So basically, there's a thing, right? There's a thing that's called positive stimulus, or basically like positive bias and negative bias. And most people are tuned in towards the negative bias because in a negative bias, we are better at that because it helps us survive, right? You want to be able to identify there's a saber-toothed tiger. But nowadays, we get so much stimuli that we're just negative about everything. So we have to learn how to redirect our thoughts to become more positive. And it's called positively biased training, and that takes time. It takes time to do that. Yeah. I had Seroquel nightmares that brought up my trauma. Yeah, I think it's not really the Seroquel. That's probably just more of the trauma re-experiencing itself. What do you prescribe for OCD? Generally, a high dose SSRI. That's the starting. I like to start with fluvoxamine. Any significant pros and cons in name versus generic brand? Yeah, generic's cheaper, of course. For most meds, it tends to be the same, but the one area I've heard the biggest difference is ADHD meds. Like Adderall and Vyvanse, I've had so many patients tell me that Adderall or Vyvanse are way better as a brand than as a generic. So I think there's definitely a difference there. Yeah, Seroquel definitely helps cause a deeper level of sleep. Yeah, helps fall asleep and stay asleep. 100 milligrams of sertraline be considered high? No, 250 is more of a high dose. 100 is like a standard dose. What's the best med change for after quetiapine for antipsychotic? So it depends on what you're trying to target. Quetiapine I like is because it's more like a mood stabilizing antipsychotic. If I'm just trying to treat pure psychosis, I'd probably go with Zyprexa or risperidone. If I'm trying to treat more mood stuff, then I'd go with Latuda or Abilify. Those would be the other things I would go with. Does autism affect the ability of meds to work? It can, yeah. You can definitely be more. I think there is more treatment resistant overall, at least in my experience. How hard was med school? I mean, it definitely was. It was a full-time job for sure. I went from undergrad, right, like only prepping a few days before tests, mainly just chilling for most of the time, to definitely like it's a job. Like my routine was like, I did class mainly from home. So I'd wake up, do the classes, maybe go to the gym, spend time studying, eat dinner, maybe watch a little bit of TV, study, and then go to bed. Like that was the routine pretty much. It was just study and work and then gym with some TV. And then occasionally I played video games if I had some time off. And then every 2 weeks we would go out because like that's when we have a test. So our going out was every 2 weeks. And then third year was really hard of med school because that's when we did rotations and you have to do a full days of work, and you have to study for a shelf exam too, which is basically like a topic exam on like whatever rotation you're doing. So that's what makes it pretty hard. But then I like working, so it's hard because you're just kind of working and you're just grinding for and without getting any kind of result. Like you're just literally just learning. Now it's way better because it's like, okay, now the payoff is here and now I can actually use that knowledge to make a difference. Med school is way harder than pre-med, of course. Yeah, med school is just the start. Watching your lives brings me comfort. Thanks, man. Appreciate that. Thoughts on venlafaxine for tolerating social anxiety or treating social anxiety? Yeah, it's good. It can be very stimulating, so I would just be mindful of that. Some people get too stimulated. What medication can be paired with stimulants to help cope with the irritability and anxiety? Guanfacine and clonidine. Those would be the top two. Or propranolol. Yeah. Would you ever take a med for social anxiety? Yeah, I have patients who've done it. I've never personally. I've had like mild to moderate social anxiety. I've never had it severe. But if it's like stopping your functioning, then yeah. Yeah, it is what it is. I wish we had psychiatrists like you in Australia. Oh, I'm sure there are. You just got to find them. You just got to find them. Yeah, there's people everywhere. I think it's just cool that now through social media, everyone can be online and like share themselves. Have you ever taken a med? I've never taken a psych med before. No. I mean, I've tried Xanax one time. I didn't really feel anything. I tried Adderall one time. I also didn't really feel much. So, yeah, that's all I can say. Propranolol too. Yeah, you can use that for social anxiety. What's the difference between psych and psych NP? So, a psychiatrist is someone who goes to medical school, and then they do a residency in psychiatry. A psych NP is someone who goes to nursing school, and then do further specialization to become a provider, like a practitioner, and then they specialize with psych. How hard was it to get into your dream specialization? I mean, it was moderately hard. I think I had an advantage that I'm a USMD, so that makes it easier than if you're a IMG. IMG is definitely harder. Like for example, my cousin actually didn't match this year. He applied psychiatry, and it's definitely getting harder and harder. Like psych used to be kind of like a backup joke specialty because people didn't want to do it. Now mental health's become cool and a lot more trending, and people are really valuing lifestyle. So now it's a lot more valuable than it used to be. I wonder your hairline and forehead must be best friends because they go way back. I'm not even sure what that means. No psychiatrist ever tried psych meds. Do you think that's weird? Would a cancer doctor try a cancer med if they don't have cancer? Would I don't know, a police officer go to jail if they've never done a crime? Like, that doesn't really make any sense. Gut health, what's its impact? Oh, it's huge. Gut health is the hugest thing. Uh, I was treating a patient today. She has a lot of anxiety, OCD, and we did an infectious testing on her, and we realized that her infectious testing, she was positive for a bunch of stuff actually. So she was positive for like herpes virus. She was positive for CMV, strep, and I realized that okay, she has a lot of chronic inflammation going on. So that was a big deal for her. So like I'm now I'm trying to target the inflammation that's happening. So I definitely am a big believer in like gut health and functional health and that type of thing. I like the brain scans available. Do you think they help? Yeah, I mean, they're okay. I don't really work there anymore, so I can't comment on it too much. But yeah, they're a tool. It's not like they're like a game changer. Yeah, why is okay? We got to stop spamming the same thing because they just keep repeating. So if you want me to read your question, best way and like prioritize it, best way to do that is not by repeating it over and over because then that makes me less wanna answer the question. Yeah, so definitely I would recommend subscribing. What did you recommend for her gut health? So I recommended N-acetylcysteine. Well, hers wasn't gut, hers was more inflammatory. So I recommended to her N-acetylcysteine. That's what I recommended. And omega 3s. And then she also has the MTHFR mutation, so we did folate and B12. But I'm going to do curcumin soon too. After a high dose of sertraline, what would you recommend for obsessive thoughts, exposure, and response prevention therapy? Can you have GABA supplements with Adderall? Yeah, you can. Those are definitely separate. Yeah, you can definitely have GABA. L-tyrosine may boost Adderall effects a little bit. And L-theanine is calming too, so that's nice. Are you dry eyes from LASIK? No, no. I've just had dry eyes as a kid. I've never had LASIK. Is Psych NP less skilled compared to a psychiatrist? Yeah, usually it's the training is less, so that's why. And it's kind of a shame, because that's why a lot of Psych NPs actually they come to me. They ask me, "Hey, can you supervise me? Can you sponsor or can you collaborate with me? Can you be my supervisor? Can you teach me?" Like I've gotten a lot of those requests just because they felt like they were robbed from their education. I've heard a lot of people say that. So that's why I actually created a Psych NP coaching program. So that way I can share my knowledge, stuff that I've learned from med school and residency and fellowship, to people who need that knowledge, right? To other practitioners. So that's why I created it. Because like that's a way that I can spread my impact by helping other people too. Are you drinking tea for your enjoyment? Yeah, I always drink tea at night. Naltrexone for BED. It's okay. Like, it's not the best. It's better with Contrave, which is the Wellbutrin. I think that's the heavy hitter. How often do you prescribe MAOIs and TCAs? Very rarely. TCAs sometimes, MAOIs rarely. Yeah. Top 3 video games. Number 3, Pokemon Omega Ruby or slash Pokemon Ruby, slash Sapphire slash Emerald. Number 2, Witcher 3. Number 1, Resident Evil 4. What do you think of saffron? Saffron's good. It's good for mild anxiety to moderate, but like the severe stuff or severe OCD, it won't really touch. Is Klonopin and Xanax okay to prescribe at the same time? I probably wouldn't. Yeah, I don't like stacking two things together like that. Thoughts on the Freudian hate? I believe defense mechanism and covering the unconscious valuable. Yeah, I think it's I think it's valuable too. I think a lot of it just gets blown out of proportion. People have a more moderate view of Freud now. Like, he defined the field. Like, he was a pioneer in what he did, and just the amount of exposure and public persona that he got, like, he defined that. So of course you always get some negativity with that too, right? You always have haters. Have you heard of Zinzino? I have not, no. Got prescribed valproic acid for bipolar. What are the side effects? I'm scared to take it. Got prescribed valproic acid for bipolar. Yeah, valproic can have some side effects too, for sure. Like some liver issues, weight gain, hair loss, irritability, gut issues. But it's a really good med for bipolar, like bipolar 1. So if you got prescribed, you probably got prescribed it for a reason. Bailey says, best advice for endometriosis. So I'm definitely not a, OBGYN, but for endometriosis, best advice for endometriosis, probably bringing down your inflammation. So, that's a condition where there's a lot of inflammation going on. So take your omega-3s, eat a low inflammatory diet. Curcumin's really helpful as well for inflammatory reduction. Maybe oral contraceptives, right? Birth control. SSRIs, maybe for the severe irritability. But I'm definitely not an expert in that. But I have treated people who have PMDD or PMS, and usually in that case, we'll either use OCPs, oral contraceptives, or SSRIs. Yeah. Did you ever finish Resident Evil 4? Yeah, bro. I beat it like 10 times. The original I beat maybe like 7 times, maybe a couple times on professional, and then the remake I beat a couple times too. How to target inflammation? Yeah, so you want to basically target it with diet, sleep, exercise, and those are the top 3 ways, and supplements. So diet, eating a low inflammatory diet, low processed diet. That's very key. Exercising just regularly, sleeping a lot, not sleeping enough is the biggest cause of inflammation. And then just supplements like omega-3s and curcumins. Those would probably be the top 2. Use guanfacine for dementia? No, usually use antipsychotics for that. Guanfacine could bottom people out, especially when they're older like that. What do you think about clonazepam? I like it. It's my favorite benzo. It lasts a while, so that's the nice thing about it. How to gain weight for cheap? Yeah, just carbs. Literally, rice. Eat a bunch of rice. Yeah, exactly. Easy. Or actually, my hack was peanut butter. Like, literally, 2 scoops of that is 200 calories, 7 grams of protein, and maybe like 5-6 grams of fat. Have you tried an SSRI or SNRI for PMDD as well? Yeah, I usually go with Cymbalta in that case for PMDD. Peanut butter is so good, yes, but you have to go for the organic type. If you go for the non-organic stuff, then it's just mixed with sugar, and that's not good. How do you stop limerence? What is limerence? I don't know what that is. What meds do you find work best for nightmares? Prazosin is number one. Trazodone is helpful as well, and clonidine. Drinking while on duloxetine and aripiprazole, bad or fine? I mean, like, you could get away with it. Yeah, you can get away with it. I just would try to space it out. So ideally, just take those in the morning rather than at night. Do you offer preceptor for NP students? Yeah, that's something I've been thinking about actually. But these are like, for that request, I would only take it from our NP coaching academy that we have. So I just opened it up like a month and a half ago, and literally we've reached over 100 members. So, I'm coaching a bunch of NPs already. And so I'm only going to be considering requests from people in our program because, they get priority, and frankly, I get to just know them better. So that's why. But so if you're a NP student, I would definitely look at joining, especially joining the program, especially if you're someone who feels like, okay, you feel like you may not have gotten enough education. You feel like, hey, I really need, I want to step up my psych game. You want to be prepared for when you actually do start your first job, because it's going to be overwhelming, especially if you haven't had good mentorship. And if you want to be able to find a job, you want to be able to network with other NPs, psych NPs, then, and you want to learn psychiatry, like especially trying to learn psychiatry for me, yeah, I would definitely look at joining our program. What's your opinion on Geodon for schizophrenia? I mean, it's good. It's not used that much because it can cause QT prolongation. You have and you have to take it twice a day. So that's the hard part about it. You can't use antipsychotics in nursing home. Really? Why not? I'm an FNP too, considering Psych NP. Yeah, we have a couple FNPs in our program actually, and they joined because they wanted to learn psychiatry. They were like, I see psych cases all the time and I don't feel adequately prepared to treat them. So that's why they joined. How do you feel about Spravato? Spravato's good. I use it for treatment resistance. Like, I use it for treatment resistant depression. That's what I use it for. I also recommend TMS too for people who are having treatment resistant stuff and they've tried some meds and it hasn't worked. Like, if they tried some stuff and it hasn't worked, that's when I think, okay, let's go to something more interventional. Limerence is when you're deeply obsessed, infatuated with someone romantically. Yeah, you definitely gotta avoid that, right? And the way you avoid being obsessed with someone else is becoming obsessed with yourself, right? Your mind goes where your attention goes. So if you focus on them, that means you're not focusing on you. So focus on your own development and your own leveling up, advancing in your career, advancing in your physical health, in your physique, in your healthy eating, in your own social skills, in your relationship with your parents, all of that stuff. Advancing in that, leveling up in those real life areas is going to help you not be infatuated with someone else. And then when you level up your own self, romantically, partners will like start propositioning you. So what have you tried to fix your dry eye? I've tried everything. I have had surgery, I've had IPL, I've had scleral lenses, I've had all the medications like Restasis and all of that stuff. So yeah, I've tried everything. These glasses work the best. Can you drink alcohol and Risperdal? Ideally not. But the one thing you don't want but it's not gonna like kill you that much. The one thing that's gonna be not to drink alcohol on is a benzo. That one's a big no-no. And I have not tried LASIK. LASIK would be very detrimental for me. Because LASIK, the biggest side effect of it is dry eye, and I'm not risking that for my dry eyes. LASIK is to cure vision. It doesn't really help with dry eye. What What is your med recommendation for insomnia with Vyvanse plus ASD meltdown as well as that? What is your med recommendation for insomnia with Vyvanse? Probably clonidine or guanfacine. Probably clonidine, especially for insomnia, and it can help cool down ASD irritability too. Cassandra asks, what is serotonin syndrome? That's when you have a bunch of serotonergic agents stacked together, and it causes symptoms like blood pressure up and down, sweating, tachycardia, heart racing, paleness, that kind of thing. Basically, it's just like super serotonin overwhelm. It's rare. Like I've never seen it, or maybe I've seen like one case in the hospital, but it's very rare. You have to be on like multiple antidepressants together. And yeah, it just doesn't happen. Multiple serotonergic antidepressants. So these glasses are they're called Xienas, and basically they have changed my life. Like from these, I was able to get off all my dry eye meds, all of my I barely do any kind of other dry eye therapy because of these glasses. Like I was importing meds from India because it was $400 per month here for Restasis, and then and Zydra, and it was like 30 there. But ever since I got these glasses, like that's all I do. So they're called Xienas from 7eye. And yeah, if you actually, I asked the company, I actually reached out to them and I was like, hey, I want to promote your glasses because I literally wear them every single day. So yeah, 7eye, yeah, 7eye. I'm currently an FNP student and I'm starting clinical this summer. Did you mention FNP students? Yeah, so I was saying we have a couple FNPs in our NP coaching academy actually. So it's a coaching academy where I teach psychiatry to PMHNPs. And because of that, I've had some FNPs join because they're like, hey, I see a bunch of psychiatry and I want to feel comfortable and confident treating this stuff. And I didn't feel like I had good enough training to do that, and I want to be able to learn from you and learn from everyone else too. So we talk about, I have all the modules on medications. We have a weekly coaching call, all how to diagnose all the different psych conditions. So I think it'd be helpful for you if you are going to be seeing any kind of psych cases as an FNP student. Yes, yeah. FNP students can join as well. Yeah. Best way to titrate, yeah, you can either there's a couple ways. You can just look in my bio to do that. That's one way. Or or just send me a message. That's the best way. Do I do telehealth? Yeah, I see all my patients telehealth. Yeah. So the best way to if you're considering working with me, the best way to do that is to book a consult, and then we can see if we're a good fit together. So you can just send me you can look in my bio and you can send me a link there, or you can see the link there, or just send me a message and I can send it to you. And all the details are in my bio. You have a scary ghost figure behind you. Oh, I know. They're just hanging out. Yeah. My psychiatrist wanted to prescribe me a mood stabilizer for irritability associated with depression. Yeah, mood stabilizers are used more for like treatment-resistant depression, irritability. So that makes total sense. I have lots of headaches, so I take Benadryl and Advil to ease off. That's not good. It could cause recurrent headaches. How do we book an appointment? Best way to do that is just look through my bio. That's the best way to do that. Or just send me a message. Can Wellbutrin send you into mania? It can, yeah, if you're bipolar. Thoughts on Luvox? I prescribe it all the time for anxiety, for OCD, sorry. Yeah. Is there anything we can do with the BS and psych? Not really.